And I'm going to share some about really nurses' role in promotion of patient safety and prevention of medical errors. So it really builds on the colleagues on this panelist's information. My clinical background's pediatric critical care, and we've been dealing with medical errors way before COVID. And I work as a clinical practice specialist for the American Association of Critical Care Nurses. And I'm going to share some of their successes, some of the staff nurse successes, and some of the challenges as well. And none of you get off the hook. I'm going to have a call to action at the end. So next slide, please. So being on the front lines of patient care gives nurses actually a unique perspective on how to improve the quality and efficiency of the healthcare system. My program, I teach in a leadership academy program and really work with direct care nurses in leading quality improvement initiatives around the country. And I'm going to share briefly some outcomes from nurse-led innovation initiatives and also about the culture, and that builds on some prior discussions today, that supports and empowers nurses in their role to impact patient safety and prevent medical errors. Next slide. So here's some of the outcomes I want you to look at. And remember, just looking at some of the research on how medical errors occur, how hospital-acquired conditions occur, and especially looking at how do we really change that. I think these are just some of our 85 direct care nurse-led change leadership projects that I want to showcase. And really, it's about we're working with direct care nurses not to just take, and this is the point that many of you made already, you can have protocols, you can have committee-approved orders, but to really get implementation in practice and really make changes on these errors has to have ownership by the nurses. Nurses are the largest spend the largest amount of time with the patients in the ICU. And so for them really to own those practices, really dig deep and see what are behind some of the errors, and then develop some interventions to get buy-in and look at sustainability has been the key to success. Mind you, we've still got many challenges throughout the country. I'm going to draw your attention to the Lenox Hill Hospital, their project, and they're currently in place right now. We've been working with them for a year, all in the middle of COVID. They really have had major COVID surge challenges with their staffing, and yet these staff nurses, given the time, and they were given protected time to really look at their hospital-acquired conditions, and those include central line-associated bloodstream infections, catheter-associated UTIs, MRSA and C. difficile infections, pressure injuries, and falls. They really looked at what's really behind this, and they determined that they really needed to implement patient safety risk rounding and really look at their handoffs and also standardizing their patient room setup. They developed some fun ways to do this. First of all, they had to study it and figure out what were the real challenges here. They developed mnemonics, slogans, logos. They had T-shirts to heighten the team's understanding of what they were trying to change. And these outcomes produced in 6 months' time, mind you, we follow them to see about sustainability, a decrease in hospital-acquired conditions by 50%, by increasing a standardization in their rounding processes and also in their room setups. Interesting of note as well, and equally as important, is they're working with other units then and other ICUs there in the middle of New York City at Lenox Hill. And they're working with other ICUs then to get champions on those units to develop their own processes and look at risk rounding to actually look at safety and error prevention. And again, as you note on the slides there, you can access the other projects and really dig deep into how they implemented change on their units. Next slide, please. So this really goes along with what colleagues talked about you can change both the errors in practice by looking at the highest hospital-acquired conditions and infections and target some interventions there. you also, and what we've learned is you really have to look at the work environment and the culture then in which errors occur. And this is a schematic. AACN actually released healthy work environment standards, looking at the research behind what creates a healthy work environment. And I'd strongly suggest your teams looking at an assessment of the culture. And to get to those optimal patient outcomes and really look at the risks and safety, you need both clinical excellence. Some of you have written in the chat the importance of staffing, absolutely, with intensivists, with qualified nurses and pharmacists and other allied health team members. And to really look at that, we need to look at the work environment to see what those impacts are and look at standards in that. And there are many research studies then on our website that is repeated demonstration of these results for the past 20 years. Next slide, please. So some of the challenges in really decreasing hospital-acquired conditions increase if you really look at the work environment, and I've got some studies cited here. And we're actually trying to look more timely as well at what the current environment is, especially during COVID, and listening to the nurses that are writing in their stories of their own work cultures. But we know by research that when there are healthy work environments are paid attention to, that there's decreased mortality, there's decrease in hospital-acquired conditions and medical errors, there's increased quality of care and patient satisfaction. And a key point to look at right now has to do with turnover rate. We have a real high turnover rate and some really sad predictions if we don't do what Dr. Rima had talked about earlier, the risk of not paying attention to the work environment. Current survey by AACN this year, 92% of nurses surveyed, and there were 6,200 nurses, stated that the pandemic has depleted nurses and they will cut their careers short. So this is really a challenge to look at. Not only do we need to look at nurses as surveillance and critical care lifesavers there at the bedside, we need to pay attention to the work environment, because we know better work environment produces better quality, better outcomes, and yes, lower costs. And so what we've done in our leadership training with nurses, and especially in the US where costs are such a huge challenge for us, we actually also help them look at strategies to enhance change in their unit and really own that change, to get buy-in for change, as well as look at the fiscal savings then from decreasing hospital-acquired conditions, as well as nurse turnover. And the greatest benefit in most of these studies was found with the higher acuity in the sicker patients, which goes along with what other panelists have described. Next slide. So here's the deal. Here's what I'm asking you to do. It's really a call to action. With improving quality and transparency, organizations will need to seek ways to engage and leverage the knowledge, the power, and the leadership of the nursing workforce. And that optimizing patient care also positively impacts nurses in the healthcare team. Investing in nurses and supporting them to grow in their leadership skills, their understanding of business, their understanding of data and quality improvement in programs such as our CSI Academy is really vital to patient safety. So empowering nurses to lead these changes, really getting buy-in on their units to really determine solutions that will really look at safety and preventing medical errors is key. The other key is that we've got to assess and address the work environments, because this is vital to patient safety, and that includes nurses' well-being and keeping nurses then at the bedside and the point of care. There is a healthy work environment assessment tool that I think not only points out some of the challenges, but also can highlight some of the successes and some of the strengths of the teams. And if we're not addressing our work environment, we're not addressing patient safety. So restoring the well-being of nurses through improving the healthcare work environment will have broad benefits for patients and families, as well as society. And the need is really urgent, and the time is now. And growing and supporting direct care nurses' innovation and leadership is a return on investment. It's a win-win for patients, for nurses, and organizations.